my name is Karina Murphy. I'm going to talk to you about single parenting with multiple children and how it affects our health. The description of that population would be a single guardian with children living in the home under the age of 18. A mother or father may be their primary place of residence, where they have their space and their belongings. A reason for a single guardian would be a widow, being divorced, or never have been married. During the 1970s, divorce became more common. The numbers climbed in the 1980s and then took a small drop. The reason for single families has also changed. The 1920s, it was due to the death of a spouse. In 1970s to 80s, more commonly seen in divorce. In the 2000s, it's because they have never been married. In 2002, about 1/4 of children in the United States lived in a single-parent household. Data shows the biological mother is most commonly seen as the head of household. Due to the changing roles within the home, single fathers has increased since the 1980s. Most recently, the amount of adopted children by single individuals has grown substantially. According to the Census.gov, single-parent families are less likely to have completed college, leading to lower family incomes, leaving their living space smaller without the opportunity to buy a stable home. The size of population locally, according to Census.gov, Davis County in 2017 has 5% of households were run with single-parent homes. Within Utah in 2017, San Juan County had the most female head of household homes, Utah County having the least. Utah versus the United States Census, single-parent homes with children in 2010, Utah had 7.3%, whereas the whole United States had 8.8% with single-parent homes with children. In 2019, there were 957,619 homes in Utah. Using this 5% in 2017, that makes 47,881. Some social determinants of health are clinics and offices ask people to please only bring one child to appointments. With parents that have multiple children and one parent, they lack the family and support that can help them with child care, with their necessary visits. Balancing between school hours, work hours, and provider availability can narrow down the time frame, the least convenient times for family and friends to help. Could be during regular working hours or nap times, or when people need to share the vehicle. Healthcare understanding is another topic. Lack of understanding of when a child should be seen, or not using resources to know when a child needs to visit the doctor, not knowing what questions to ask, may not know preventative measures for optimal mental, emotional, or physical health. Some more is economic determinants. Lack of education may limit jobs available with insurance offered. Less amount paid per hour means it's more hours worked. Less time available to make medical dental appointments. You can't really afford to take the time of work off, and working hours conflict with office hours. Maybe you work weekdays. That's the same hours as the office. No employment, it could be due to location, access, education level, transportation, opportunity, or communication barriers. Some contributing factors. Common concerns for the children may be increasing the chance of dropping out of school, more likely to become teen parents, greater chance to being exposed to drugs and alcohol, higher rate of gang activity, doubling the chances of going to jail, increasing the crime activity, more likely to commit suicide, twice as likely to not marry or get divorced, and 4 times as likely to need cognitive behavioral therapy and a daily poor diet, leading to long-term health concerns. Some parental concerns are having child care provided that's safe, keeping a routine and consistency, having stability and clear rules set, no time for meeting teachers and friends that are valuable people that we need to be involved in our children's lives with, Maybe we have a lack of time to process our emotions when communicating with our children. Maybe we can avoid any placement of guilt when interacting between divorced parents. Not hating the parent not present. Not involving children in our financial limitations and stresses is a concern. Some root causes could be economic stability, or the lack thereof. Sleep deprivation and stress can weaken the immune system. Education. If you don't have a great education, you could not know how to give yourself the best health, the best way to eat, the best way to exercise, the best habits to make that can keep you healthy and strong. And maybe you don't have the knowledge to know how to access this health care opportunity. Social and community would affect the amount of support and programs that we have in place, or that we know about, or that we utilize. Responsibility versus time. Balancing work to provide materials necessary, tending to the children, to their full-time emotional and physical needs, and time management with all of these demands is very difficult. No insurance is again an issue, increasing the negative health outcomes if we do not carry insurance. Medical attention without insurance is expensive. Some contributing factors as Maslow's hierarchy of needs met would be physiological. We can breathe, we have air, we have food, water, shelter, sleep, clothing can be provided in single-family homes. Safety with modern technology is easier now that we have devices where we can communicate our needs and changes as they come. Love and belonging can be met when children have that love and stability of a parent that is disciplined and puts quality time into their child daily. Self-esteem. A single parent can build up their child's confidence and show them through their actions that they matter. Self-actualization means allowing each child to problem solve and critically think. They can learn to feel capable and empowered, to improve and to grow. Some of them not met, on the flip side, could be safety. Children may have more time alone or take advantage of the lack of supervision. Without an adult, they could have a higher level of responsibility. And if they don't take care of it, then they could get into real trouble. If a family doesn't have insurance, they will most likely have more severe health outcomes, which is a huge safety risk. Another thing not met for love and belonging could be, depending on the parent's lifestyle, that the child may feel neglected and unloved. If the parent is gone a lot, the child may not feel the parent has concerns of their well-being or their feelings. Self-esteem could not be met. If the child feels they aren't important and that the parents choose to be at work or distracted or occupied or not present, then it affects their direct self-esteem. A child can tell when they have your full attention, and a single parent has lots of reasons that they are truly busy, but if they make little effort to invest in the time with their children, then they take that message of they are not important. Self-actualization not met is a desire to expand and improve will not be reached if they do not feel they have purpose, unconditional worth, and a family team that believes them and stands by them. Anticipated function level is isolation with basic needs met. Hard to do more than that. Likely outcomes, depression, and a decrease in immune systems. Specific concerns, communicable diseases or infections. There are not any communicable diseases or infections that are directly associated with a single-parent family with children. The outcomes all depend on the behavior of the parent. Non-communicable diseases or infections are also something that does not have anything associated directly with a single-parent family with children. Single parents may have an increase of stress that may decrease their immune system. They may have depression. They may have no insurance, which could cause to bad health care and negative health outcomes. Self-care and self-harm. High levels of stress could cause burnout. Without feeling support, you feel alone. Depression, hopelessness, and helplessness can be felt if you do not have a support group or help from a spouse. Substances to self-medicate. You might think reality is too hard or your expectations are too hard and overwhelming. So you might use substances or have thoughts of suicide. Any risk for harm by or to others? Burnout could lead to emotional abuse. The workload required may leave the children feeling neglected. Children find other role models to look up to if the parent is not present. Outside influences to teach and educate our children as they seem fit. Depression, depression, depression. It could lead to substance abuse or thoughts of suicide. Sleep deprivation from getting pulled in too many directions will cause severe thinking impairment. And these are my resources. Thank you for your time.